Hello everyone, welcome back to my channel. So this podcast is about Allium cepa according to Dr. J.T. Kent in his lectures on homeopathic materia medica. So let's get started. It's given that Allium cepa is used principally for colds. There are various phases of these colds in the nose, in the throat, in the larynx, and in the bronchial tubes. Especially, so this sentence gives us an idea that Allium cepa has an unbelievable affinity on the respiratory tract overall and overall organs as well. The patient and all the phases of his cold, his coryza, his laryngitis, his cough, all his complaints are aggravated by warmth and are worse in a warm room, excepting the tickling in larynx, which is sometimes aggravated by drawing in the cold air. So that's an important point. So overall, all the complaints when they are aggravated with a warm temperature or while entering into the warm room, especially the respiratory complaints, you can think of Allium cepa, and but the exception is when there is tickling in larynx, which causes the cough. Due There may be sometimes it is caused due to inspiration of cold air, so that's the only exception. In this way, the cough is sometimes excited by cold air, but the patient himself is better in cold air and is sensitive to heat. That is a very important point because when you have some respiratory complaints, we tend to prefer some hot climate or hot things as such, not the cold ones. But here, the patient is better in cold air and is very much sensitive to heat. Most of the symptoms are worse in the evening. The symptoms of coryza, the cold, and the general symptoms. These are the two most striking general features of Allium cepa. So, yeah. Coming to the next para, it is not strange that the old ladies used to bind onions on the ear for earache and around the neck for sore throats. For onion is very frequently indicated in almost every climate for the effects of cold. So yeah, that's the strength of the onion. And here are some examples where how it was used crudely in the past for the treatment of colds. Cold, damp, penetrating winds in any climate are likely to bring on Allium cepa complaints. So that's important. Cold, damp, penetrating winds in any climate. That is a very important point. Most of the times we tend to generalize some remedies specific to certain climates as such, but this sentence gives us an idea exactly the winds are important and not the climate. So in any climates you have some cold, damp winds, you can think of Allium cepa, whether it is in summer, winter, or rainy season. And there is coryza, la grippe, influenza, or whatever they may be called, and usually there is congestive headache. So generally cold is most of the times accompanied by headaches, so that's a common symptom. And rawness in nose, copious flow of water from eyes, which is always bland, copious watery discharge from nose, which is always excoriating. These are two very important points. Rawness in the nose, in 24 hours it reaches the larynx. Cough excited by tickling in the larynx and while lying down at night in a warm room. On going to bed in the evening, Allium has its most troublesome aggravations. And there are patients who describe the pain in the larynx on coughing, saying that they felt as if someone was reaching down with a hook at every cough. So that is a thing they can exactly experience the mechanism of the cough, exactly beginning of it from the larynx. So that is the important thing. And there is tearing in larynx with every cough, and there is sneezings, and there is rawness of all the mucous membranes, and they are all worse in the warm room and the evening. It is astonishing how quickly the onion will break up the cold. That means how Allium cepa we deal with cold is very surprising and very shocking according to Dr. Kent. And there are some particulars in of the coryza, and that is like earlier it has been described. There is like always acrid coryza and the sneezings, and they are in increasing frequency. And there is almost constant watery discharge from the nose, which is burning like a fire, and which also excoriates the upper lip and wings of the nose until there is rawness and redness. And it's like commonest description or commonest comparison is between euphrasia and Allium cepa. In euphrasia there is acrid lacrimation is present and bland coryza, and there is so much congestion that the patient has a sensation in the fullness in the nose with throbbing and burning, and sometimes there may be nose bleed as well. And there is pains through the jaws in the face, and these pains extend into head. Dull frontal headache as seen as such in sinusitis, which commonly accompanies colds in most of the patients. And There is dull frontal headache, occipital headaches, headaches very severe, and the eyes cannot stand the light. There is tearing, bursting, throbbing in the head. So overall, there is extreme sensitivity of the eyes, nose, and also headache is common. So these are the commonest complaints you find in clinical conditions like sinusitis or upper respiratory tract infection, coryza, allergic rhinitis, laryngitis, sometimes even croup. So now there is another phase of this medicine. It begins on left side and goes over to the right. What which he meant to say is, I do not know, but it usually does this. So he's not sure why it does that, but there is a symptom that the complaints begin on the left side and go towards the right. And stuffing up of the side of the nose, watery acrid discharge from the left side of nose. In another 24 hours, the right side is invaded. So there is stuffiness and the blockage of the nose of the left side, and within the 24 hours, the similar experience is given from the right nostril as well. And there is profuse nasal discharge, colds after damp north and easterly winds, and that is after damp cold winds, for they make conic from different directions in different localities. And there is flu and coryza, not to forget about the headache, tears from eyes, and want of appetite, cough and trembling in the open air. But in general, they crave for some open air and cold things as such. And every year in August, morning coryza with violent sneezing, very sensitive to the odor of flowers and skin of peaches. I would like to add something to this point, because in the previous podcast about Allium, cepa from the boric as well as alliums when discussed, I have already mentioned that the point in the it was meant to say in August means in the spring season. So in different areas the different spring season is different. So in India it's from mid Feb to mid April, wherein there is like excessive pollen and dust tend to accumulate, where the patients tend to wake up sneezings from the violent sneezings. So you can think of Allium cepa in such conditions, and it will wipe out an attack of hay fever in a few days when the symptoms agree. We You may know that the true nature of hay fever is not generally understood. It is really only an explosion of chronic disease. That is, it is a manifestation of sora and can be eradicated only by anti-soric treatment. So here is a tinge of arginon, or the exact explanation given by Dr. Kent. And many a time I seen hay fever wiped out in one season by a short-acting remedy, only to return in the next just the same, and perhaps another remedy will be required. So what he meant to say is, these violent sneezings or sinusitis, which may seem to be like an acute problems, only most of the times generally seasonal, but the thing is it's due to the internal manifestation of the sora and can only be corrected when a deep antisoric remedy is given, not just by the symptomatic treatment every season. If we go on giving up, like depending upon the symptoms, only the acute remedies, the thing is they'll return in one form or the other in the next coming seasons. There will be symptoms, if you know how to hunt for them, they differ altogether from the acute attack. Exactly. So in any case presented in between before us, the patient has generally completely most of the times they have the mixed case, like some are related to the acute condition of the patient and some are of the chronic condition. So the thing is, if we are intelligent enough to separate those two things, we will understand which remedy to give when. And when the hay fever is one of on these do not appear, it is a difficult matter to find a constitutional remedy when the hay fever is at height. Exactly. When there is an acute emergency or acute intervention of remedy is needed, it will be waste of time if we keep on digging for the constitutional remedy, and most of the time we don't have a clearer picture. And he meant to say is, it is a difficult matter to find a constitutional remedy when the hay fever is at height, for it resembles an acute disease, but it is a manifestation of sora like another manifestation of sora, as eruption and cough. So acute disease should be treated, but it should not be seen as an acute one, and should be understood a deep-seated sora has projected in such a way of acute exacerbation of itself. The nose may manifest only a certain phase of chronic disease in one season, which may, for instance, be suited Allium cepa. He gives an example of a case. I remember one time having occasion to prescribe Allium cepa at a long distance. It was near a homeopathic pharmacy. I wired the pharmacist to send my patient Allium cepa and he labeled it. Well, the patient kept the bottle and used it next season, but it did no good. That is likely to be the case even when the symptoms seem to agree. In psoriatic condition, a short-acting remedy is insufficient. It may help for one day only, and the deep-acting remedy that includes the patient as well as the hay fever and all other symptoms will have to be administered. The best man to treat hay fever is after the acute attack subsides and until it begins again the next season. It will then occur in a greatly modified form, different from any patient has ever had, and calling for a different remedy. That will be the case if constitutional remedy has been properly selected. So I'll try to give a gist of the whole paragraph which I've just narrated as given in the book. The thing is, what he want to say, if you just keep in consideration of the patient's acute presentation of a disease, the thing is it will return the next time the in the same or the modified way, and it requires altogether another remedy. So he gives an example where a patient was given Allium cepa, and it worked in one season but it did not do much help in the other season. What he mean to say is, when a proper antisodic remedy is given, the thing is the symptoms doesn't appear the similar way in the next time, and it next time needs the disease takes a modified form and it needs a different thing. And when the correct constitutional prescription is given, most of the times the symptoms become less violent, and the patient cannot recognize the symptoms, like he has been accustomed when one sort of suffering, and suddenly his suffering has got down to such an extent that he feel very good. So in that cases you have to think that there has been some constitutional prescription along with the acute along with emphasis on the acute exacerbation of the inside sora. And in these coryzas, the inflammation soon spreads to ears, the throat, and the larynx. So there is overall involvement of the upper respiratory tract along with the ears. So that is a thing. And there are some comparisons between Allium cepa, pulsatilla, and chamomilla. And it is given that with pulsatilla, chamomilla, and Allium cepa, you can cure the majority of the earaches in children. So there's been a short comparison between these remedies. Stitching, tearing pains in ear with whooping cough, with coryza, with laryngitis. In the household where a medicine case is kept, pulsatilla is a standard remedy for earache, and it is true that only occasionally has a doctor to be sent for. Pulsatilla has such a strong affinity for ear that it will cure earache in almost all sensitive children who cry pitifully. But those who are snappish, who are never suited, who will throw away something they have asked for her and slap the nurse in the face must have chamomilla. So yeah, this is a description and comparison. Further, as to the eye symptoms that accompany Allium cepa colds, remember that the discharge from the eye is bland. Although there is burning in the eyes, the tears do not excoriate as they flow down over the cheek. That is a very important thing. There is burning eyes, but the lacrimation is as such not burning, that they won't cause burning when they roll down your eyes onto the cheeks. And we all know that what a flatulent vegetable the onion is. It is wonderful medicine for babies with colic. Cutting, rending, tearing pains, drawing the paw a little almost double. It screams with violent cutting lower abdomen, stitching pains in the abdomen, colicky pains beginning in hepatic region, spreading over the whole abdomen. And yeah, that is about the colic. And especially in children, Allium cepa has also cured a ragged sensitive condition of anus with bleeding in infants. So such a useful and wonderful remedy, which is, I guess, very least used, especially with the infants, because most of the time we have this emphasis only upon sinusitis as such. It's very rarely thought of, but after you listen to this podcast, I guess you have an idea, or after you reading Kent also you'll be having an idea. But the thing is, I've just revisited that or reignited that point that even Allium cepa is useful in colic in children. I mean, that is infants, as well as for hemorrhoids in infants, and acute complaints of the voice. It can be thought of, and it is already described. Some will describe as the larynx is being torn, and there is cough and difficult breathing from inspiring cold air. Yet a warm draft will so increase the tickling that it's sure to set the patient cough. So there is absolute sensitiveness to both extreme temperatures, but warmth tend to trouble the patient more than that of the cold. And if tickling in larynx, the cough from inspiring cold air, worse in a warm room, and in the evening with tearing pain in the larynx are present, Allium cepa will cure. So it's just a sentence wherein all the conditions of Allium cepa has been aggregated, and cepa has a record for croupy cough as well. And here's a very good description for guiding symptoms. There is hoarse, harsh, shrinking, spasmodic pain, spasmodic cough, severe laryngeal cough, and there's a description between aconite and Allium cepa. There is the child severe laryngeal cough, which compels a patient to grasp the larynx, feels as if cough would tear it. The child will reach up to the larynx and clutch it. This is wholly different from aconite condition, where the child, after exposure to dry cold wind, takes before midnight with a hoarse barking cough and clutches the larynx. So aconite cannot be substituted for Allium cepa. What he mean to say is acute, extremely acute conditions, and before midnight only, after exposure to the dry northeast winds, if the child develops hoarseness, larynx in the larynx and cough, aconite is used. But in Allium cepa, there is a development of symptoms a bit. It takes a bit of time for the development of the symptoms. And another affection over which their remedy is marvelous power is traumatic neuritis, often met with in a stump after amputation. The pains are almost unbearable, rapidly exhausting the strength of the patient. So yeah, that is about Allium cepa according to Dr. JT Kent. It's been a bit long video because the description has been long and it takes a bit of time to refer Kent. My soul and whole intention is to deal with the Kent lectures, which is very much least opted by the students as such. But the proper understanding of the remedy is only possible if you just go through the Kent lectures, because it's a description of the remedy to such an extent where you can grasp the whole core of the remedy, wherein you can treat in any situation and in any scenario where if symptoms agree. So that confidence and that knowledge Kent lectures can provide. So that's why I'm even started adding Kent lectures podcast, and hope this podcast was helpful. Do subscribe to this channel for more videos and more podcast on materia medicas, different materia medicas, and don't forget to give a like. And if you have any special request, do comment in the comment section below. I would love to make a video and try to help you guys. Thanks a lot for listening to this podcast. Have a great day. Bye.